Look at my BBL, 3.5 months post-op. Just kidding. I didn't have a BBL. It's kind of like a BBL, by lower body augmentation. I did have fat transfer. You don't have a fat transfer when they're lifting your body and suctioning all the fat out. It's literally as flat as a door. Like, here's a study that shows why fat transfer is important. And it's the exact same methodology as a BBL, except with the BBL, you're going in there for only cosmetic purposes to make your butt larger. I'm so glad that I didn't have that, because my butt hurt for like 3.5 weeks, like constant 24/7 torture. Right now you'll see my hips and my back are swollen because I had a revision here. So this is all swollen. I'm about like 2.5 inches, maybe 3, larger than my normal size because I had a revision here. So I'm going to be more swollen here. I do kind of have this hourglass shape, but you can still see like my hip dips. Like, I have hip dips. I didn't have my hip dips filled in. I didn't have like a cosmetic BBL. I have lipedema. So my fat was taken out and then washed and then put back in, and none of it's fibrous. Once it's been manipulated like that, the fat doesn't work the same way as when it's like stuck in your tissue and growing. Dr. Batis is a lipedema specialist. He talks about it more, but lipedema fat doesn't behave that way once you've gone through the process to move it. Also had brachioplasty, torsoplasty, and maxiplasty. I had lipedema and excess skin removed because I lost 121 pounds with my PCOS routine, and then I was diagnosed with lipedema afterwards. Part of my routine is like literally the conservative treatment for lipedema, which is why I was able to get diagnosed and then go through the process and get insurance coverage. Like literally within 7 months I was having my surgery, which is insane. My routine was like everything that was needed except for compressions and MLD, but I only needed to have a few months of that for insurance. I can talk about that another time because I'm getting tired, but I just want to address this comment because of course there's cosmetic things that are taken into consideration when you have a procedure like this, because you don't want to leave somebody with like excessively loose skin. I believe all of my surgeries that I had should be covered by insurance because literally it's all for functionality, pain, and so that I don't have so much heaviness, rashes, swelling, and all those issues. Yes, I'm dealing with itchiness and swelling and pain after the surgery, but this is only going to last like 6 to 12 months. And as long as I conservatively manage my lipedema with my PCOS routine and MLD and compressions whenever I need it, I will have a much happier life, because I've had this condition since literally puberty, okay? So it's been really validating to understand how it's affected my life so much. And so I'm not really concerned about my little tush right now, because this is not the final result. I'm gonna be uneven, I'm gonna have uneven swelling. It's just part of the process, and that's okay with me and my body. Do whatever works for you, right? And I hope you have a good day.